Again, welcome. Thank you to our webinar today on the psychological impacts of vestibular disorders. My name is Cynthia Ryan, the Executive Director of the Vestibular Disorders Association, and I'm very excited to be presenting this today. In my experience talking with the many vestibular patients who contact VITA via phone and email and on our Facebook page and our online members forum, I think these are the things that I hear people talking about most. Cognitive impacts of their vestibular disorder, problems with focus and with memory, and emotional impacts of vestibular disorders, with being invisible disorders that other people can't see and often don't understand. And I think that these two things impact vestibular patients probably more in some ways than the actual physical impact of dizziness and imbalance. So I think it's really important what we're going to be talking about today, and we have some wonderful experts with us today, Drs. Eva Mihovic and Rachel Bilgray, both psychologists who have dedicated their clinical and research on helping vestibular patients, and especially with these particular problems. So without further ado, I'm going to go ahead and pass it off to Eva and Rachel.
Thank you so much, Cynthia. This is Rachel Bilgray speaking. Welcome, everyone. I'm excited to be here as well, and I hope that this will be an informative and helpful webinar for all of you. What we hope to do today with this webinar is to identify common psychological reactions and phenomena associated with vestibular disorders, and to destigmatize any psychological responses that you may have been experiencing. They are more common than you think, and you're not alone. So the first slide talks about different ways that vestibular disorders can impact you. There's the physical, the cognitive, the emotional, and the social. And we have them in overlapping circles because they all affect one another. The cognitive and the emotional, the social, which are more of the psychological symptoms, they all affect each other, and they affect your physical symptoms, and vice versa. You may find today that some of the things that we talk about, all of the things, only a few of the things, maybe most of the things affect you. And that's because vestibular disorders affect people in different ways. So we hope that some of the things that we talk today resonate with you, and whatever that is, we hope that you get the most out of it. So now we have our first poll. In what ways does your vestibular disorder affect you?
Okay, so I have launched the poll. I hope everybody can see it. Can you see the poll and okay, poll in progress here. People are answering. We have a three-way tie so far, but it seems that we have 87% of the people who are responding say they're affected physically, 80% cognitively, 83% emotionally, 80% socially, and only 5% of you have said that you are not affected by your vestibular disorder. Although, let me just preface this by also saying, I'm going to go ahead and close the poll now, that I looked at our attendee list, and I know that there are several vestibular professionals on board, healthcare professionals like physical therapists, and I'm going to guess that those 5% are those healthcare professionals. So I would venture to say that everyone, all the patients who are attending here today are affected equally by all the aspects of their vestibular disorder. Rachel?
Yes. All right.
Okay. So if we can move on to the next slide. Okay, this is Eva. And I want to thank you for this opportunity, and I believe Rachel gave an excellent overview of the purpose of this seminar. So I believe that Cynthia, I believe we need to start with physical. We're now on cognitive. Okay, yeah, okay, thank you. There are many physical impacts of vestibular disorders. First and foremost is fatigue, and your body is doing a good deal of, exerting a good deal of mental and physical energy in the task of trying to navigate you safely in an environment that is highly unpredictable because of your vestibular problems. And as vestibular problems really occupy a tremendous amount of your attention, so you tend to need to self-monitor your internal states very, very closely. Vestibular patients also have an increased and sometimes exquisitely sensitive reaction to physical stressors. These can be external physical stressors such as noise, excessive visual stimulation, weather changes, and so forth. Impact of diet, certainly salt can impact upon people with Meniere's and so forth. Hormonal fluctuations, some women experience changes in their vestibular symptoms in terms of their menstrual cycle, and some vestibular patients suffer tremendously in dim environments because of the lack of visual cues.
So what do we mean when we use the word cognitive? Cognitive is just a fancy word for thinking, and thinking has to do with paying attention and concentrating, remembering, reasoning, problem solving, decision making, organizing. It includes visual motor and spatial difficulties like eye-hand coordination. It also includes something called internal certainty. Activities that are normally automatic, that we never really have to think about. When you have a vestibular disorder, you have to meticulously focus on and think about a lot. We're talking about when we talk about cognitive abilities and cognitive problems when you're having a vestibular disorder.
Okay. There are many emotional sequelae of vestibular disorders. The most predominant is anxiety, and anxiety can range from nervousness in terms of being able to kind of figure out what's going on in your environment, to fear of falling, which is quite realistic for many vestibular patients, to panic attacks, which are incredibly difficult to cope with, that you feel like you're dying, you hyperventilate. Also can increase your sense of dizziness. And some people with panic attacks develop agoraphobia, which is the fear of leaving their homes. Depression is also quite prevalent in people who suffer from vestibular disorders. That can range from a sense of helplessness, hopelessness, a sense of loss in terms of loss of function, and what I call demoralization syndrome, which I find is quite frequent in people with chronic medical conditions, where they sort of kind of give up hope that they can be helped. Interpersonal stress is also quite frequent in vestibular disorders because, quite frankly, people don't understand them. It's, even though there's a high prevalence of vestibular disorders, it's not a well understood condition among the general public. And also, too, people with vestibular disorders can experience a really profound sense of loss of self, a loss of feeling effective in their lives, and even a sense of identity.
So our social being is also so much affected by vestibular disorders. There's a lot of self-consciousness. Perhaps you worry about being perceived as drunk or lazy, not being able to do the things and activities that you normally do and be the person that you usually are in your relationships and at work. This can result in a tendency to withdraw from social situations, to isolate. Because really, who wants to participate if you can't really do it in your usual way? Public knowledge about vestibular disorders, as Eva was just mentioning, is also very limited. And it's not only limited to friends and family and the lay public, it's also the medical community, which is a sad thing to say, but it is true, and we're working hard to change that. But in the meantime, you know, it's not surprising to hear from people, you know, that they've gone to a doctor's office and the doctor says, you know, it's all in your head. You know, or when speaking to family and friends and trying to explain what it's like to have a vestibular disorder, they say, well, I get dizzy too. But this is different. This is not just getting dizzy. And it's not all just in your head. And having these experiences with people can have you feel very misunderstood. And it can change your relationships with people. And that will just you know, perpetuate that feeling of wanting to isolate and just withdraw from your social world.
The world can become very small for someone who is suffering from a vestibular disorder. Frequently, people with vestibular problems tend to avoid activities of all types, socializing. It can be quite difficult to be in a noisy restaurant, for example, or carrying on a conversation in a party, sports, hobbies, and so forth. One can suffer a sense of decreased independence, which in our culture can be a humiliating experience. And in concert with that, there can be an increased reliance upon others, which can be quite uncomfortable. People with persisting vestibular disorders over time have a diminished ability to function on the job, to do household duties, to carry out child care, and so forth. And fundamentally, with a vestibular disorder, you just need to take more time to accomplish tasks, which is incredibly frustrating for the person with the vestibular disorder and sometimes for the people around them. Now, how is the brain involved? It's a very complex relationship in terms of the vestibular system and the brain itself. The inner ears are kind of nestled in the middle of the brain, and due to its location, the inner ears are in close proximity to the limbic system, which is very important. It's a system of various structures and organs in the brain, and among the most important are the hippocampus, which is associated with learning and memory, and the amygdala, which is associated with strong emotion. So the limbic system helps to motivate us, it helps us process our emotions, and it also helps us with learning and memory. And the hippocampus in particular deals with perceptual memory as well. Animal studies and some human studies suggest that these anatomical factors contribute to the strong impact of vestibular disorders upon both cognitive and emotional functioning in people.
Okay, so let's spend some more time in each of these areas. So let's first spend some time with the cognitive issues. So disorientation and confusion are common during the acute stages of a vestibular disorder, and they can be quite frightening and disturbing moments. Knowing who and where you are, the time of day, may not be readily available to you. And while these moments are very overwhelming, they are just that. They're just moments. And typically, as that the acute physical symptoms fade, clarity will begin to return. So now we have our next poll question. What kinds of changes have you noted in your thinking patterns?
Thank you, Rachel. Okay, I'm going to get this poll going here, and we would love to hear from you. We've got some options here, wondering if you're noticing changes in your memory, your multitasking, visual and motor skills, feeling mentally foggy, and as you can see, you can select not just one option, but you can select as many apply to you. So I'm going to leave this up for just a few more seconds, and give everyone a chance to vote on it. And I will tell you now that I'm seeing that a lot of people are having a lot of problems in a lot of areas, which is not surprising. Most people have voted, so I'm going to go ahead and close the poll. We have, I'll give you the results. Excuse me here. We have 71% of the people, there we go, 71% of the people said that they had problems with memory, 78% had problems with multitasking, 69% had problems with visual or motor tasks, and 84% said that they often feel mentally foggy.
All right. Well, it's a good thing that we're going to be talking about all those things then. So let's continue with cognitive stamina, which I think would probably fall under that mental fogginess. Vestibular disorders certainly can have you feel foggy and can interfere with your cognitive stamina or energy. Cognitive energy is finite for everyone. It's actually why phone numbers are only 7 digits, because that's been determined as what we can adequately remember at any given time, believe it or not. So if you're using a great deal of energy to maintain equilibrium and stay steady, something that is normally done automatically, it's unlikely that you're going to have very much left over for your other activities. And then the cognitive fatigue sets in. Just as our bodies can get fatigued, so can our minds. And I think that that's that fogginess that many of you are saying that you feel. Activities that you once previously performed with ease are probably now requiring incredible amounts of effort, leaving you drained, and probably requiring rest periods and naps throughout the day if you're able to do that. This doesn't leave very much room for spontaneity, because everything that was once automatic now has to be thought through and planned for.
The vestibular vision connection is very complex and very, very interesting. Human balance is mediated by the inner ear vestibular system, the visual system, and the brain through proprioception. Now, in terms of vision, we have the vestibular ocular reflex, which is sort of kind of like the stabilizing mechanism in a camera. When your head moves around, your gaze stays stable, your eyes stay stable. And in a vestibular disorder, this gets disrupted, so your eyes can develop unusual movements, such as rapid jerky movements known as nystagmus. And there can be the sensation of bouncing objects in your visual field, and I believe that's called oscillopsia, if I'm pronouncing that correctly. Also, too, when people have problems with their inner ears, they frequently overutilize vision to help them maintain their balance. So if you have difficulty maintaining focus, such as in a dimly lit environment, that can create an exacerbation of your vestibular symptoms. So that is one of the reasons why patients with vestibular disorders have tremendous problems with visual stimuli. For example, vestibular patients frequently complain of very exquisite sensitivity to bright light, particularly fluorescence. Moving objects can be problematic. Patterns, particularly repetitive patterns, can create visual difficulties. The combination thereof of all of this can create a tremendous amount of visual confusion. Also, too, people can have difficulty in dim environments because they lack the visual cues that they normally have in well-lighted situations, so they become very insecure about their balance in the darkness. And we also know, because of the vestibular system's nearness to the hippocampus, which is involved with perceptual memory, that things like navigation can be difficult for vestibular patients because simply the brain vestibular connection is flawed.
Vestibular disorders interfere with your ability to pay attention and concentrate. So you may find that it's difficult to sustain your focus for a significant length of time. You may find that you get easily distracted, either by external stimuli, whether that be the noise of other people talking, traffic, TV, or other things in your environment, or it also can you could also be distracted by internal stimuli, which are your thoughts and your feelings. Multitasking might be incredibly difficult. You know, the ability to do and keep track of 2 or more processes at the same time is compromised. You may struggle with even just sustaining focus on one particular thing. You may notice that following directions, filling out forms, following recipes, tracking conversations, following the plots of a movie, anything that requires sustained attention, but also anything that involves sequencing can be difficult. You may also notice that you may mix up sounds while speaking, or reverse numbers or letters when speaking or writing. And these are problems in sequencings that we do see with people that have vestibular disorders and are having trouble with paying attention and concentrating. The most common cognitive complaint that I've heard about or is associated with vestibular problems is short-term memory loss. Short-term memory loss has to do with, say, remembering what you have for breakfast versus long-term memory loss, which is remembering things from much further in your past, like the name of your best childhood friend. And often, though not always, a memory problem is more likely to be a problem with attention and concentration, because building blocks of memory are attention. So I always like to use a bank model to describe this phenomenon. When we want to deposit money into a bank, there's a whole process that we have to go to. I mean, nowadays we use ATM machines as opposed to going to the teller. But you have to put in your passcode, you follow prompts to make sure what you want gets deposited correctly into your account so that later it can be retrieved. And you get a receipt, you get a confirmation that what you did happened. And the same is true for information. We have to go through a process. Our brain has to take in the information, and it has to get deposited correctly. It has to get encoded in order for that information to be available to us later on for it to be retrieved. If we don't go through that process in the way that it needs to be gone through, it won't be encoded properly, it won't be deposited properly, and then it won't be there later for us to remember it. So oftentimes we feel like we have a memory issue because we can't remember the information, when it very well may be that it actually was never there to begin with, because our attention and our concentration isn't working to get the memory, to get the information in there. So another problem that people often describe with a vestibular disorder is problems with executive functioning. In the article that I wrote for VITA on the cognitive aspects of vestibular disorders, it's attached to this webinar for you to download. I ask you to imagine that sitting behind your forehead is an executive behind a desk. And this executive is responsible for overseeing all the cognitive and emotional activities of your brain. And this executive organizes and problem solves and makes decisions and monitors and supervises. This executive is responsible for that internal certainty that we mentioned previously, for how thoughts get organized and plans get executed, and it happens pretty automatically. This person is pretty good at their job, except when there's a vestibular disorder. And then even the most simple plans, like getting dressed, are disorganized and very disorganizing. And no decision, like even deciding what to have for breakfast, becomes simple. This executive is under the desk sleeping.
Emotional issues are really very salient in vestibular disorders. Rachel and I participated in a research study about 10 years ago at Lusk Institute, where we were both working at the time, where we surveyed approximately 250 people who entered our vestibular rehabilitation program. And of that population, fully 71% tested out as having significant psychiatric issues, the most important of which and the most prevalent of which is anxiety. The literature ranges on the incidence of emotional problems, anywhere from 30 to our high of 70, and I think we can attribute some of that being in New York City, which is a very neurotic place to be.
And not good for people who have vestibular disorders.
It is very bad for people with vestibular disorders. But in any event, we really have focused a lot on treating anxiety in our respective practices. Because emotional factors can have a significant impact on our physical health and our ability to recover. And we do know that emotional stress can have a negative impact on things like our immune system. Very importantly for vestibular disorders and their sufferers is the fact that there is a very vicious cycle that can develop. And because of the nature of vestibular symptoms, you're particularly vulnerable to these effects. What will happen is you might wake up one day with a bout of vertigo, and because you don't know what's going on, you might have a really strong anxiety response. That's your body responding to the stress, the threat of not having a predictable environment and your perception being off. Now, anxiety in itself can cause dizziness. It is one of the acknowledged symptoms of dizziness. So it mushrooms from there, so that you have a physiological situation, then an emotional situation, which really potentiates the physical symptom. And so it gets worse and worse and worse unless you can intervene both for the physical and the emotional. I often like to say that vestibular disorders are the quintessential mind-body problem because there is such an intimate interplay emotional state and their vestibular symptoms.
Totally. So common experiences that we've heard from people that suffer from vestibular disorders that can set off some of these emotional disturbances. As Eva had mentioned previously, I think a fear of falling is a biggie, and certainly you know, we can understand how that can bring on some very significant anxiety. You know, I've heard so much about the frustrating diagnostic process, the lengthy, convoluted journey to getting a diagnosis and then getting treatment. You know, finding the right people within the medical community that understand what's going on and where to point you in the right direction.
And also, too, the treatment itself is anxiety-provoking. The PT
Yes.
can exacerbate the physical symptoms, which creates even more anxiety in the person.
Yes, I know some people who didn't even want to go for treatment because they were afraid that it was, and it does activate your system. It's the idea of getting your system to accommodate, but it does produce the symptoms. So it really is, it's really tough. The sudden onset of symptoms, the unpredictability and variability of symptoms is unsettling, to say the least, and turns your world upside down, literally and figuratively. You know, as Cynthia mentioned in the beginning, just before we started, the invisibility of a vestibular disorder is incredibly difficult. It's not like a broken limb or even a runny nose or a cough. It can't be seen. And, you know, very often you don't look sick or unwell. However, just because it's invisible doesn't mean that it's imaginary. And even though people can't see it, it doesn't mean it's not real. But because people can't see it, it can lead to other concerns, like being perceived as lazy or being perceived as drunk, as I had mentioned earlier.
Anxiety, as I mentioned before, is the most common psychological or psychiatric problem reported by vestibular patients. And I'd like to reiterate, it can range from basic nervousness that we would consider to be well within the normal range for experiencing a sudden onset of a very, very disturbing symptom or a collection of symptoms. There can be specific phobic fears, the most common of which is fear of falling. Other people develop phobias about things like restaurants, riding on public transportation, and so forth, and become, more avoidant of certain situations. And then there's a fairly large segment of vestibular patients that actually suffer from panic disorder. If you have a panic attack, you do not forget it. It's an extremely upsetting event where your heart rate increases, you hyperventilate, your dizziness can increase, you can have physiological symptoms such as severe nausea, a feeling that you're going to die. It's really incredibly horrible, and oftentimes people end up in the panic attack because they fear they're having a heart attack. In the worst case scenario, the panic attacks can come with agoraphobia, wherein the person literally becomes a self-imposed shut-in because of fear of going out into the world. And unfortunately, that can occur with some frequency in people who suffer from vestibular disorders. I believe that the anxiety is in many ways an understandable response to not being able to trust your perceptions. You feel ungrounded and a basic insecurity about being safe in your body and the world.
Yeah, and I often, in my practice feel that fear and anxiety is often what's interfering with functioning more so than the actual physical symptoms. The physical symptoms have been managed, whether it's through vestibular PT, and at this point it's really just the fear and anxiety and the distrust of one's body that's really interfering with life. So vestibular disorders can really change one's lifestyle. It can change your level of activity, we can move on to the next slide, Cynthia. Your level of independence, your stamina, your relationships, and all of these changes are and can be experienced as losses. And there's a grieving process that goes on, and that can, lead to sadness and depression, social isolation and withdrawing from friends and family, results in feelings of loneliness, feeling misunderstood by family and friends and by medical doctors can lead to feeling helpless and hopeless. Oftentimes people will also describe feeling guilty about not being able to do their usual thing, as if it's, something, as if it's their fault when it's not. Other common symptoms of depression are sleep difficulties, which can be having trouble falling asleep, interrupted sleep, staying asleep, or even sleeping too much, having trouble getting out of bed in the morning. Eating disturbances, whether it's eating too much or not eating at all. And fatigue, low energy, lethargy, and not getting any pleasure out of activities that you would normally get pleasure from.
The social consequences of vestibular disorders, I think, are sometimes underestimated. We are social animals, and we require social interactions for maximum physical and mental health. But with a vestibular disorder, there are many forces that tend to create a situation where a person with a vestibular disorder becomes more socially withdrawn. Certainly, we've talked a lot about people feeling misunderstood. Um, and it ranges from the various issues involved with having a hidden disability, which is, for many people, a mixed blessing. They're glad that they don't look, quote-unquote, sick, but they also regret that people don't fully empathize with their situation. Rachel spoke before about people being socially concerned about how they appear, that they might look drunk or somehow out of it in social situations, creating a tendency to withdraw. And also, too, I think that sometimes people perceive that others feel that they're malingering, that they're exaggerating their symptoms. Which is a highly uncomfortable situation and creates a tremendous amount of emotional upset for people, and certainly increases their feelings of being misunderstood. Because people with vestibular disorders take more time with tasks, sometimes need some assistance in certain tasks, they're put in the uncomfortable position of asking for help, which in our culture is really frowned upon. We pride ourselves in being very, very independent. So that, again, can increase a sense of social sensitivity. And this is a very, very common problem which leads to a more isolated lifestyle, because the symptoms can fluctuate so wildly because of things like the weather, atmospheric pressure, hormonal situations, and so forth. People are reluctant to plan for future events, so that locks you out of a lot of things that would increase interacting with others. And also really kind of impedes your ability to be spontaneous, because you may feel that you could go out there and then something will happen and your symptoms will flare up. So there's a whole complex of situations, both in terms of the vestibular disorder itself and the social environment, that really kind of really mitigate towards vestibular patients becoming a bit more socially isolated and withdrawn. And now we go on to our next poll question, which is, how has your vestibular disorder affected your social life?
All right, I'm going to go ahead and launch that. And let's see, poll is in progress. Go ahead and vote if you can see that. We've got some options here. This is one where you only select one option at a time, one option, not all the options that apply to you, so we can see kind of the difference between the way that people are affected by, socially affected by their vestibular disorders. We've got about 80% have voted so far, so I'm going to give people just a few more minutes. And we do have an interesting distribution here, with most people kind of in the middle. I've got so far about 10%. I'll go ahead and close this. It looks like everyone who's going to vote has voted. 10% say that they don't attend social functions anymore. 24% say they go out less frequently, limiting their social functions. 45% say they go out less frequently and must recover after their social functions. I think that's what I hear most from people, is that they recognize they do go out less frequently, but when they go out, they have to plan for it so that they have recovery time afterwards, because it does drain them. 14% say they still go out as much as before but feel tired afterwards, and 6% say that their social functions, it does not affect their social functions. So what I'd be interested, Eva and Rachel, to see how that compares with your experience with the vestibular patients that you see in your practices.
I would say that it probably pretty much mirrors what the poll just showed us. I have a lot of people, and sometimes what we talk about is whether certain social events are worth what, like, you know, the next day staying in bed. You know, what is worth going out and you know, engaging in that social activity if it means that the next day they're just down for the count. You know, they're not going to really be able to get much done. They're going to be in bed. They're not going to really be able to do much work or go out. So I would say that people do still go out socially, but there's a recovery period that they have to think about.
Yeah. And they're also, in my experience, tend to be choosier about where they go.
Yeah.
Certainly in New York, people tend to scope out restaurants as to their noisiness because that is quite a challenge for most vestibular patients. And also, too, large gatherings are quite problematic because of the difficulties in monitoring multiple conversations.
Yeah.
And definitely the crash time is really a major factor.
In my experience, probably the most profound change that I hear people talk about, and the one that's really, for me, the most heartbreaking, is the changes to your sense of self. You know, even I have run education groups at the Rusk Institute, and there was one many years ago that I ran, and we were discussing this topic, and a woman shared her experience of looking in the mirror and not recognizing the reflection as herself. And there was nothing about her physical appearance that had changed. You know, it's not as if, you know, anything about her condition made her look different, or that she went and got her hair done differently or anything. But I think it speaks to how differently people can feel in their bodies and how much that changes how they experience themselves. You know, the discrepancy between how you know and experience and how you knew and experienced yourself before your vestibular disorder can really erode self-esteem and self-worth. You know, your identity can really be questioned when your abilities have shifted, when your roles in your relationships have changed, when you're unable to perform your usual responsibilities. So for me, and from the work that I've done with people that have vestibular disorders, this is the one that feels the most profound, the most life-altering.
Well, now we get to the good part of this talk, which is kind of talking about how you can cope better with your vestibular symptoms and the resulting psychological symptoms that you might be experiencing. First and foremost, a healthy lifestyle is to be highly encouraged. Good nutrition, particularly if you have a salt-restricted diet, is very important. Rest, 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 and appropriate exercise. And exercise is very good for emotional regulation. It's very good for cardiovascular health, cognitive health, and it also is a very good way of really challenging your vestibular system. You know, if you take a walk, you're looking around, you're absorbing your environment, and you're feeding your brain and your body with vital oxygen and really stabilizing various chemicals in your body. Now, cognitive fatigue, as we have said before, is a major, major problem. The most important aspects involve self-monitoring. And one of the things you can do is have like a rating scale of 1 to 10, with 1 being, you know, quite energetic, very peppy, 5 being normal, and 10 being crashing. And then just periodically, just check in where you're at. For example, if you're at a 5, then you can, kind of forge ahead and work a little bit more. But if you start edging into, let's say, a 7, then that's time to consider whether you need to take a lengthy break or even stop the activity. What you really want to avoid is going much beyond that 7, because that's where you tend to crash and burn. Pacing and self-monitoring becomes very critical in terms of gaining a sense of control over your ability to function again. Once again, taking breaks is important for all of us, and it's particularly important for people with chronic medical conditions. It can be vestibular disorders or chronic pain. Rest and recuperating your energy state is critically important.
So what are some ways that we can cope with attention difficulties? So one of the most helpful ways is to use all of your senses. So when you're speaking to someone in person, talking on the phone, if you're at a medical doctor's office, not only do you want to listen, but you want to repeat back what was said. You want to write it down. The more senses that you use, the more that information is going to get deposited, like that money. It's going to get encoded. And then it's there for you later on in whatever way that you may need it. You also want to try and minimize distractions whenever you can. So, you want to do your work, whether that's actually in your place of employment or at home, if you're balancing your checkbook or just reading. You want to make sure that you're doing this in a quiet place with as little external distractions as possible. And your employer should be providing that kind of accommodation. They're required to do that. Internal distractions are harder. These are the thoughts and feelings that can become very overwhelming, and that inner voice that can become quite loud when you don't want it to be. And what I would suggest with this is, if you find that thoughts and feelings are bombarding you and really interfering with your ability to sort of sustain focus, take about 5 minutes and get a piece of paper. And whatever's going through your mind, the thoughts, the feelings, whatever it is, won't take you very long because it's going to be right there for you. And then take that piece of paper and throw it away. Put those feelings and thoughts aside, get rid of them, and then try, once you've cleared your mind, to return to the task at hand. If you find that multitasking is difficult, then don't do it. Try just to focus on one task at a time, seeing that through to completion, feeling good about getting that done, and then moving on to the next one. With memory, it's pretty straightforward. Make lists. Check them often. It's better to have one big list, because sometimes you'll write down something on a Post-it note here and then another Post-it note there. So maybe if you had one notebook in one place, or you kept a small notebook that you carried with you, that you could sort of jot down when things come to mind, or if a partner or a family member asks you to pick up milk, you can quickly jot that down and refer to it and check it and cross things off. That's really going to be the best memory aid. If you're also working on your attention and concentration, you may see an improvement with your memory, but as a strategy, that's the best one.
Mm-hmm.
Eva.
Yes, and in this day and age, I'm finding that people will effectively utilize their cell phones,
yes.
The smartphones or iPads can be utilized for this, and you can also use the voice memo
yes.
Function of your smartphone to help jog your memory. For example, in New York City, where did you park your car?
Right, right. Right, and there's so many great apps for whether it's making lists or even, organizing and planning your day, which brings us, to how to deal with executive functioning issues. And with that, it is using a daily planner, using an organizer, and that certainly can be one of the bazillion apps that are out there now, on your phone. But creating a structure and routine to your day and following it consistently can make a very big difference. You want that structure to be flexible. You don't want it to be too rigid, because if it's too rigid and it's too hard to follow, it's not gonna work. But the routine and consistency of a structure can really help bolster security and that internal certainty and automaticity that we've been talking about. The other important thing is to prioritize. It's really important to distinguish what's most important and what can wait. What's something that you'd like to have done versus something that really needs to get done. And if you use, whether it's an app or like an old school daily planner, you can map out your day and see where you have the time and what's most important to get done first.
Visual skills really demand a fair amount of interventions. For vestibular patients who have difficulty with bright lights or excessive stimuli, stores, grocery shopping can be extremely challenging. It might be useful to have a pair of sunglasses available, or a baseball cap, or some sort of hat with a visor to restrict some of the fluorescent lighting impinging upon your eyes. You can calibrate your visits so that you go when it's less likely that they will be crowded. When possible, and computers, and we will talk a little bit about how to deal with computers. If you can have a printout or read from printouts, that's probably easier for most people with vestibular problems. And you can also change the font size to accommodate whatever your visual needs might be. But for many of us, we cannot exactly get away from our computers. So there are various tried and true strategies to help deal with computer eye fatigue, some of which can be helpful for people with vestibular problems. In general, you really need to cut the overhead fluorescent lights and have kind of like a very similar lighting situation as to the brightness of your computer screen, so there's less discrepancy in your visual field. And you can alter the brightness of your computer screen to accommodate your particular needs, and you can enlarge font and so forth. And it would be helpful to avoid as much glare as possible, either using an anti-glare screen. And the old CRT screens are very, very difficult visually. So in this day and age, flat panel screens are really much better for people with visual problems. Oftentimes our eyes get dry when we look at the computer screen because we don't blink enough. So it's really kind of important to remember to blink your eyes frequently when you are looking at a computer. And there's the 20-20-20 rule, which is that when you're working at a computer, you work for 20 minutes, then you take a 20-second break, and you stare at something that's approximately 20 feet away to give your eyes the ability to focus on a distant object, and then return to the computer screen. Another technique is a palming technique, which you can basically cup your palms over your eyes as you are resting, and blacking out your environment allows your eyes to rest, and the warmth of your palms relax your eye muscles.
I always like to rub my palms together very harsh to create friction and warmth. and then place them over the eyes, because that really helps with the darkndarkness, but also the warmth. It really makes a difference.
Yes, that is precisely what helps to relax the when possible, listen to information rather than reading it. And as we're doing now, I'm pretty much reading what's on the screen, and you know, that in combination with looking at it on your computer screens is actually a very good way of kind of integrating the information. Okay, now there are various interventions for the social and emotional challenges that vestibular patients face. In the treatment protocol that we've developed at RUSC, which is basically a cognitive behavioral mindfulness-based approach, we really work on identifying symptoms and triggers of stress and the vestibular symptoms. In terms of, we do have a handout that is in the resources part of the presentation that we actually do use at RUSC to help patients track their symptoms. And what we're looking for are, you know, what are the symptoms? Is it dizziness? Is it lightheadedness? Is it balance difficulties? Is it feeling wobbly? And there's a whole panoply of symptoms because vestibular symptoms are very, very much an individual bag of tricks for people. And there are various triggers. Weather is a classic one, noise, light, lack of light. Just plain stress can be a stress, can bring on the symptoms. And then integral to our program are training people in various stress management techniques. And many of them are available in the general world. We often recommend Tai Chi, which is a very gentle martial art that has a meditative component and has been established as a very good technique for improving balance, yoga, meditation, breathing exercise, and we'll talk a little bit more about breathing later. Learning to figure out when you need to have some help, when you need a little bit of assistance to complete a task, will relieve your internal stress and the external expectation of having something completed. Acceptance. In the mindfulness model that I tend to use in my work, there's a concept called radical acceptance, wherein you basically accept the fact that you have a condition that impinges upon your life. And that can be incredibly liberating because you expend so much energy fighting it. And if you can learn to live with it and develop a different relationship to it, you will actually free up a tremendous amount of psychic and physical energy to go about your business. Certainly VITA promotes support groups throughout the country, and if one is available in your location, I would strongly urge you to partake of that. Certainly individual psychotherapy can be very, very useful. And my favorite of all, have a sense of humor. Okay, feeling overwhelmed, when you feel very, very anxious or panicky, the best down and dirty technique is to breathe. We know that physiologically the act of slowing down and deepening your breath is a quick and proven way of reducing your physical stress response. It literally is a thermostat. Your flight, fight, or freeze response will slow down and sometimes stop if you breathe. There is a breathing technique that I like to use with vestibular patients. It's called the grounding breath. And in that breath, it's a mindfulness breath where you feel your feet on the ground if you're seated, or if you're outside, you stand with your feet flat on the floor and touching like a wall or some other thing with one of your hands, so you have 3 points of contact. And just taking a nice deep breath and imagining it going all the way down to the ground and feeling your feet on the ground, and maybe even imagining that they're the roots of a tree. What that does is that it gets you in touch with your feet, which counterbalances any sensations of lightheadedness or dizziness. And then when you breathe out, you imagine anxiety or stress leaving your body. The other aspect of kind of slowing down the volume is to use positive coping statements rather than negative statements, saying things to yourself like, I'm okay, this will pass, I've survived worse things in my life.
So how do the cognitive problems that we discussed today get addressed in a treatment setting? Cognitive rehabilitation or cognitive retraining, cognitive remediation, it's called various different things, is basically like physical therapy for the brain. It can be done by an occupational therapist, by a speech therapist or a psychologist, and it's basically a two-pronged approach. The first prong is the rebuilding of the skill. So if, once your problems are identified and understood, let's say it's attention and concentration, that specific skill is practiced and strengthened through a variety of different kinds of exercises. The second prong of this approach is learning compensatory strategies, many of which even I have talked about today, and that's utilizing your strengths to overcome your weaknesses. It's developing a bag of tricks that are at your disposal to get around different problem areas that you have. Treatment provides individualized attention to your specific problems, and it will normalize and validate and support you through your journey, whether it's still rehabilitation or life in general.
Well, as you know, Rachel and I are both clinical psychologists, and we strongly believe that working with a therapist provides you with the opportunity, the interpersonal struggles you might be experiencing, and in terms of helping you develop improved communication skills. And it also gives you a safe place to ventilate your feelings and your concerns, which in our culture is a very precious thing. It can help you with accepting the disorder and how it's impacting upon your identity, and it helps you to create a more integrated sense of yourself. Some types of counseling or psychotherapy, such as cognitive behavior therapy, are really kind of very much directive therapies that target specific symptoms. Cognitive behavior therapy, or CBT, is a well-known intervention for anxiety, where we train people in various relaxation techniques, techniques to restructure negative thought patterns, problem solving, and so forth. And there's also another technique called mindfulness-based stress reduction, which is based on Buddhist meditation practices, which has been very heavily studied and has tremendous impact upon changing your brain in very, very healthy ways. And it improves self-awareness, emotional reactivity, and actually even improves your immune system. So that we do have some very powerful interventions and can provide you with a toolbox to help you cope with the various problems that one experiences when one has a balance or vertigo problem. And now we are in our next question, which have you which is, have you seen a counselor or a therapist for support related to coping with your vestibular disorder?
All right, I've launched the poll, so if you want to go ahead and vote, we would love to see who has had the experience of seeing a therapist and how you feel it has benefited you. I know that as you said, Eva, you and Rachel are psychologists, and you do this all the time. You work with vestibular patients specifically, so you know how much this can help. I am a little biased. My husband is a psychotherapist, and I do believe that that having someone to validate what you're going through can be really helpful. So I'm going to leave this open for just another minute to see if anyone else wants to vote. So far, I'm seeing the results say 38% say yes, they've seen a therapist and found it helpful. 11% said they have seen a therapist but did not find it helpful. 10% said they've seen a therapist but are undecided, and 42% have not seen a therapist. And I think one of the things we have to learn there is that a lot of people just haven't tried this option. And something else I want to point out, and I'm sure that you can expand on this, is that it's so important to find the right therapist. I understand that the number one reason that therapy is successful is that there's a positive rapport between the therapist and the patient. And besides that, there are some therapists who probably don't understand vestibular disorders, and or they might not be practicing in the way that is going to help you personally and individually. You have more that you want to add to that?
I hope that the webinar today will get more of those people who haven't tried therapy to give it a try, because I think, that it can be immensely helpful. And I agree with you, Cynthia. I think that, I actually really recommend, I'm often asked whether it's specifically for someone suffering from a vestibular disorder or not, I'm often asked to help people find therapists. And I always give at least 2 names, and if not more. And I encourage the person to quote-unquote shop around, because I think that when you need to find the person, and it's not that there's one person, like there's, like a soulmate connection, but you want to be able to make sure that there can be a rapport that can be established and a trust, where you're at and what you're going through. And I agree with you. I think that probably is the most important thing when you're looking for a therapist.
Yes, and I think certainly since isolation and misunderstanding is such a large piece of the mix, that having somebody who really bears witness to your suffering is a very, very powerful healing tool in this process. I do think, though, that one does have to really shop around and pick somebody that you are comfortable with. And even in New York City, where I work at Rusk, we frequently have patients vestibular patients, who are in treatment with other psychotherapists. And sometimes what we do is we will do what I call a little carve-out therapy, where we talk with that person's primary therapist and provide that therapist with literature about what we do. And then we do maybe 6 sessions with that patient targeted towards learning coping skills for the vestibular symptoms, and interfacing with the primary therapist, who is kept as the primary therapist. To that end, I did do a presentation at the Division of Rehabilitation Psychology last year, where I did an outline PowerPoint presentation of our interventions. And my name and contact information is listed towards the end in the resource section. And any licensed therapist or psychotherapist who wants that PowerPoint presentation for their own use is certainly welcome to contact me.
So here we see some of those additional resources that Eva was referring to. Both Eva and Rachel's contact information is here if you have additional questions. We've run over quite a bit, so I think I will. We have a few questions that are very specific to the individual. So I think maybe if they want to reach out to either of you individually, maybe that would be a better place to address those questions. And also this is the link to the articles that Rachel wrote for us. One is on the cognitive impacts of vestibular disorders. One is on the psychological and emotional impacts of vestibular disorders. A link to support groups that may be in your area. You can always contact VITA directly, and we can help you with that. There are quite a few support groups, but there might not be one close to you, and we are actually in the process of launching some online support groups to help those people who don't have a support group close to them but do want to connect with people individually and live. That being said, VITA has an online member forum where you can, if you join as a member, you can connect with other vestibular patients in an online conversation, and in creating your login, you can create an alias so that it is completely anonymous. There are Facebook groups where vestibular patients connect, and those you might find useful as well, although they are not specifically anonymous. And just overall, we want you to know that you are not alone, and what you're experiencing is not at all unusual. My mother has a vestibular disorder, and I know personally how it impacts her both on a cognitive level and an emotional level, and I know how very difficult it is. So I hope that you gained something from this webinar. I want to thank Eva and Rachel so much for putting this together, for being here to share their professional knowledge and also their empathy for dealing with vestibular patients. And this has been recorded, and it will be available on VITA's YouTube channel by tomorrow. So I hope that you will share it with others. I think as I was listening to it, as we were going through it, I was thinking this is not only helpful for vestibular patients, but for their friends, family, and others to understand better what you are going through and having a vestibular disorder, and why it's so difficult to understand because of the invisibility of vestibular disorder. So I hope you will share this with others to help increase awareness about the cognitive and emotional aspects of vestibular disorders. Thank you so much, everyone. Good night.